Hello, my name is Andrew Toma. For those of you who don't know me, I am a member of St. Luke's Coptic Orthodox Church in Deerfield, Florida. I'm also a practicing pulmonary and critical care specialist. That means I take care of diseases of the lungs and also when people get really sick and need intensive care. Some of you may be scared right now with all the news about the coronavirus. I just want to take a few minutes and share some do's and don'ts and some tips so that we can learn the facts about how to deal with this. First of all, this is not the apocalypse. We're not all going to die. By the grace of God, not yet and not from this. However, it is very serious and we each need to do our part, not only to keep ourselves safe, but also to preserve our community and not overwhelm our healthcare workers. So here's the list of do's and don'ts. First, let's listen to the recommendations of the authorities, of the city, state, national governments, and obey when they tell us that we can't do things. Please don't listen to what you hear on social media or the internet. There's a lot of myths going on out there that we'll address. If you do have questions, please ask somebody who is knowledgeable about this, or reference the CDC or Centers of Disease Control or WHO, World Health Organization websites. They have very good resources there. So regarding some of those myths that we're hearing on the internet, there's some things that really do not work or have not been proven that we're seeing being spread out there. So eating hot soup or taking hot baths to kill a virus does not work. Spraying yourself with bleach or chlorine or using Lysol wipes also does not work. Eating different types of foods has not been proven to do anything. That includes bananas, lemons, or garlic. Also, using a blow dryer to warm up your nose has not been shown to be helpful. There's also a myth regarding that if you can hold your breath for more than 10 seconds, you don't have the coronavirus. This is not true. Some people also believe that the virus only affects seniors, and this is also not true. I have a patient right now in the hospital who is in his 30s and is quite ill. The other myth that I hear frequently is that this is just like the flu. Coronavirus is spread more easily than the flu, and it is much more dangerous. So then what works? First, I would say that the social distancing that we've been practicing is very helpful for this. We have to avoid gatherings as much as possible. Don't shake anyone's hand, keep a distance, and don't go out in public unless it is necessary. The other thing that works is good hand hygiene. This means washing your hands frequently throughout the day, either with soap and water or with alcohol-based hand sanitizer. Also, avoid touching your face. If this means when you usually wear contacts, now is the time to start wearing glasses. If you do think you're sick, what symptoms should you be looking for? Most people that do get sick from coronavirus have fever, cough, and fatigue. Some people also get diarrhea. Most people that do contract the virus will have relatively mild symptoms. 80% of people will have mild symptoms so that they don't need to be hospitalized. What is worrisome is when people start developing shortness of breath. Shortness of breath can imply that the virus is causing pneumonia. If you are having mild symptoms and it's possible to stay home, I suggest you do that. If there's any questions, please call your doctor and get advice from them. If you are feeling short of breath and you can't catch your breath, then you need to get immediate medical attention. If you're able to stay home, then quarantine yourself or don't have contact with others for 14 days. Drink a lot of fluids. You can take Tylenol. However, ibuprofen is not recommended at this time.